Hi, Dave with Line Therapy here. Today I wanted to talk about a research article that just came out in Clinical Pediatrics in 2023. It came out in November, so maybe not just recently, but recent. It's titled Conservative Treatments of Adolescent Idiopathic Scoliosis, Physical Therapist Perspectives. And this came out, and I was reading through it. I actually couldn't access the full article yet. I'm still trying to do that, but it piqued my interest a little bit in a few different ways, because this is physical therapist perspectives. Reading through the abstract for this, it doesn't really show that it was physical therapist perspectives who are trained in scoliosis specific exercise using either the Schroth method or a different method like that. So I don't know if that's the types of physical therapists that they looked at, but it's interesting to read through and see what they found. So they were looking at what perspectives physical therapists have regarding treatment of kids with scoliosis. And so they looked at a lot of different physical therapists, but what was interesting to me was they looked at what their preferred ways of treating these kids were. So they weren't necessarily looking at what the best treatments were. They were looking at what is out there and what physical therapists prefer to treat adolescents with scoliosis, how they treat them. So let's just kind of dive into the data a little bit, the data that I can see from the abstract at least. So the preferred treatment frequency was 60 minutes. So they were doing an hour treatment, which is great. That's what we do at Align Therapy. So that was 53.8% of them. So actually just barely over, a little over half. My guess is in our current society that it was the other 46.2% were probably seeing them less than 60 minutes. So that's an interesting thing, that about half of physical therapists probably see these patients less than 60 minutes, less than a full hour. Not that that's wrong or right, it's just interesting to see. And twice weekly, so that was 41.5%, so less than half saw them twice weekly, but that was the highest percentage. So they see them for an hour twice weekly, over 3 to 5 months, so that was 44.6% of them saw for 3 to 5 months of treatment. I would say our average is about 3 months of treatment, and then we go to a maintenance. So I don't know if this includes maintenance. So it's interesting to see that that's fairly similar to what we do at Align Therapy. We're doing usually twice a week, and that's over about 4 weeks, and then we go down to once a week, and that's over 3 weeks, and then we skip a week and we see them one more time before we go to a 3-month follow-up system. And that 3-month follow-up system is geared to help them stay compliant and things like that. So kind of similar to what we do. But then as we look into, it talks about the top 3 clinical interventions that these physical therapists use on their patients. So core and trunk stability enhancement was the top one at 90.8%. So the vast majority of physical therapists who treat scoliosis in adolescents use core and trunk stability to treat them. We use that in conjunction with our Schroth exercises or C's approach exercises as well. It's not the main thing that we use, but that looks like it's kind of the main thing that other physical therapists are using, whether they're trained in Schroth or something like that or not. Abdominal strengthening, 83.1%. It's interesting that they separated out core and trunk stability and abdominal strengthening. In my opinion, core and trunk stability includes abdominal strengthening. I don't usually do abdominal strengthening on its own, so that was an interesting difference in there. And postural correction at 80%. So 80% of physical therapists that they surveyed looking at treatment of adolescent idiopathic scoliosis, 80% of those used postural correction. So that's interesting. We don't know what that is. We don't know if they're using the Lion method, the C's approach, the side shift, the Doble med. We don't know what they're using for postural correction. That could even be just telling kids to sit up straight and keep their shoulders back, which really doesn't do a whole lot for scoliosis patients. They also looked at some other things like parameters on measuring quality of life and things like that. But the biggest thing that I want to look at is, this was in a clinical pediatric journal, probably towards pediatric physical therapists, and it's looking at what they use to treat. And in the research, core and trunk stability exercise has been researched to see if that's effective in scoliosis treatment, and it hasn't really been shown to be as effective in scoliosis treatment as treating it specific to scoliosis with a specific method behind that. So it's interesting to see how other physical therapists are treating with this, and that even though postural correction, 80% of them use that, we still have no idea what that is. And in other research articles, it's been shown that we get best results with using a specific method for scoliosis treatment. So what's interesting is the conclusion on this. It says, according to our data, physical therapists believe that pediatric patients with idiopathic scoliosis can benefit with addressing core and trunk stability, a 60-minute per session, twice weekly over 3 to 5 months, and quality of life measures using the Oswestry questionnaire. Their conclusion doesn't even talk about anything postural correction wise. The research is pretty clear that just doing strengthening does not affect the curve. So this study was, well, I guess it wasn't really a study. It was just looking at what perspectives are with physical therapists. So this does tell us what the current way of treating scoliosis is. It doesn't tell us a whole lot on what's the best way. This is just what's being done. The takeaway that I have from this is, if you are getting general physical therapy for scoliosis, this is probably what physical therapists are looking at doing. They're looking at doing core and trunk stability, abdominal strengthening, and they might do some postural correction too, but we don't know what that is. So one caution is that, sure, this may say that's what's being done, but it doesn't mean that it's the most effective. So I would suggest that postural correction aspect of what physical therapists are doing, the best way to do that is to do that with a specific method of treating scoliosis, whether that's the Schroth Method, the SEAS approach, or one of the other methods. Here at Align Therapy, we do the Schroth Method for most of our patients, and we do the SEAS approach for some as well, and we get fantastic results. So just thought I would share my thoughts on that article that came out, and hopefully you've seen some of the other research articles that we've reviewed. And just remember, if you're getting treatment for your scoliosis, make sure that whoever is treating you or wherever you're being treated has research to back what they do. And I think that's important, and not just case studies, that they can bring out research articles that show what they do is effective and that you're getting good treatment. So thanks for watching, and hopefully this was helpful, and we'll do another research review probably next week. So we'll see you then.